Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for joining us for Direct Connection. We begin tonight by connecting you with expert advice on hip replacements. Joining us for this week's Your Health segment is Dr. Farshad Adib, Assistant Professor of Orthopedics at the University of Maryland School of Medicine and Orthopedic Surgeon at the University of Maryland Medical Center. Doctor, thank you for being with us.
Thank you for having me.
What is the reason people wind up needing a hip replacement?
So the most common reason is hip osteoarthritis. Hip osteoarthritis is a wear and tear type of arthritis that you can get. So at the end of the bone, you have cartilage. It's like a slippery substance, and as it wears, when you get older, you can have that wear and tear in the joint, and then it becomes a little bit rough, and then you can even have bone rubbing against the bone.
You would feel that as a patient?
Actually, some of the patients I've had that they come to me and say it feels that bone is rubbing on the bone. The first common symptom that patients have is pain. So they come up with the pain around the joint. So they can feel it in the groin, in the thigh, and sometimes it actually moves back toward the back.
We can come back to this later, but how do you avoid that and maintain a healthy hip over the course of your life?
That's a very good question. Actually, the hip osteoarthritis usually develop in older or middle age, in middle-aged people. But you can get at younger ages also. That's why we can come in and actually find out the patients that they have some predispositions, the hip joint usually is like a ball and a socket, and then sometimes you can have less coverage that we call it dysplasia, or you can have too much coverage that we call it impingement. In those patients, actually, by activity, they can have the osteoarthritis at younger age.
It was surprising news just in the last couple of weeks when one of the co-anchors of Good Morning America, a young woman in her 40s, went in for hip replacement. How common is that?
So she actually grew up in New York area, and she had a scholarship being a diver. So I would assume that she had some sort of dysplasia. A lot of swimmers, dancers, or divers, they have more motion in the hip joint. So they have more motion, which is toward their advantage to do sports like that you need more range of motion, but also you put too much stress and pressure on the joint. I assume that she overused the joint and needed that.
Now you kindly brought your hip with you, which we thank you. Everybody has two of these. In terms of the basics of the replacement procedure, has it changed much?
So the basics is the same, but there are a lot of advantages in the hip replacement. Specifically on the implant side, we have been progress, and the development has been very significant. So nowadays we expect that the hip replacement can last like 20 years, and then it lasts way longer than before.
Your hip, this comes apart.
Sure. I will show you exactly what we have here. So to kind of go over this is the regular pelvis of a patient. This is the thigh bone. So this part, we call it femur, and this is like a hip replacement. I'm going to take it apart.
Actually, if you rotate it a little, that's good. I think that shows up.
There you go. So this is the part that actually includes a ball over here, and this is like a stem or a pin. This pin goes inside the thigh bone. The ball goes over the stem or the pin, and then you can look over here. You have a plastic part and a metal shell at the back of that. So you put the metal shell inside the pelvis. So this is the pelvis. We call it acetabulum. So you have the socket, you have the plastic part, and you have the ball and the stem. So 4 pieces, and it goes like this. So that would be the actual hip replacement inside the body.
When was the first hip replacement tried?
So this actually, the history behind that is very interesting. So it's been done in early 90s, but the implants has been involved significantly. Like the type of implant that we use, there all goes back to Sir-John Chonley that developed. We are kind of following the same principles, but the material has changed. Like this ball ceramic head is the newer technology that most of the people use nowadays, especially for younger patients.
Because once it's in, and you really don't want to have to, can you reoperate if necessary?
So usually when we talk with the younger patients, we talk about that. It depends how you take care of your hip, but you might need a revision surgery. Revision surgery is a redo surgery. So you can, part of these implant could get tore up, or you can put wear and tear on one part of the implant. It could be the plastic part, it could be the stem which is in the thigh bone, or it could be on the ball. And sometimes you have to go back actually and change it. And I've had patients that I had to do 3 or 4 times. If you live long enough, every 20 years, you need a redo.
Let me remind our viewers, if you have a question about hip health or hip replacement surgery, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. Basics on the surgery. How long a procedure is it? Who's a candidate and who is not?
That's a very good question. I often get that question in the clinic because you might have some arthritis. Somebody take a look at the x-ray and tells you have osteoarthritis. That doesn't translate that you need a surgery. I always tell the patient what's the expectation from the surgery. The expectation is to decrease the pain and improve the function. So it depends how disabled is the patient. So I always tell the patient that you're the judge. Do you feel that you're not getting out of home as much as you want while you're taking some medication? Do you feel that the pain wakes you up at night? So these are like some red flags that tells you that you might need a surgery. So sometimes the stiffness is a problem, and these could affect even like the regular daily activity. Like you can't rise from a chair, you can't go for a short walk, or you can't tie your shoes. These are like some symptoms that you can have that can affect the quality of your life. And hip replacement surgery actually has been one of the best surgeries in the history of medicine.
How so?
So it helped millions of the people, and actually has lasted longer than other surgeries. So millions of people have enjoyed like having a hip replacement. And then we have something that we call forgotten hip. We have some patients that they have hip replacement, they come to me and say, oh, I totally forgot. I went to a yoga class and then I had this happen. So sometimes they even forget they had the surgery.
Who's the oldest patient that you've operated on for a replacement?
So I had a 91-year-old that the hip pain was bothering him and affected the quality of his life. Actually a very healthy guy, and then he stayed in the hospital for a day and went home healthy.
No kidding. Well, we want to get into the way you do the procedure that can get people home faster, but let's grab a phone call first. Ken in Montgomery County. Ken, thanks for the call. Go ahead.
Hi. Yeah, I was wondering, is there anything in the way of diet or exercise that can be done to help protect the hip so you don't have to have a replacement? And 2, once you have a replacement, how much running and jumping is possible?
Great questions. Thank you very much.
Thank you, Ken. That's a really good question. I'm a strong believer in non-operative treatment. So non-operative treatment starts with weight loss. So every pound on the body, when you go up and down the stairs, is about 5 on your hip joint. So you can imagine losing weight, how much can help you. The other thing is avoiding like some of the activity that hurts. So it's like a lifestyle modification. The other thing is that also is physical therapy. When you strengthen the muscle around the hip joint, it can support it and help you to decrease the pain. Also medication that we call non-steroid medication like Aleve, Advil, Motrin. These are medication that decrease the inflammation. Sometimes you get inflammation around the hip joint, and also help with the pain. And then also we do have injections in the hip joint for severe osteoarthritis. Some of the injections could help us. About diet, healthy diet always help, but we do have some sort of supplements that like glucosamine or other supplements that you will see like in all the drugstores. I've had patients that they had benefit from taking some of those, and we do have those like materials in our joint, but the studies does not support using these medications.
And the other part of the caller's question about how good can it be if you have one of those and everything goes well? Jumping jacks, I mean, go for a long run, what are the limits?
That's a very good question. You are able to do all activities you want, but we do not recommend it. Why? The reason for that is that I can't create what God created. And you put wear and tear on the regular or native hip that you had, you can do the same thing on the hip replacement. For instance, you can go for a double tennis, but single tennis might be too much pressure on the hip joint. Right. So we try to convert runners to a biker or swimmer.
You mentioned the idea of doing a direct injection of something. It's football season. You can't look at the sports page without somebody's knee is getting scoped and they're doing something arthroscopically. Is there an equivalent procedure for the hip?
Exactly. We do have hip arthroscopy for the hip joint. The hip arthroscopy is a minimal invasive surgery that you go through 2 or 3 small poke holes, but it's a little bit a different type of patients that you actually treat with the hip arthroscopy. They are usually younger patients with minimal cartilage damage. If you have extensive cartilage damage, unfortunately, the minimal invasive surgery is not going to be successful.
There's no stem cells or plasma-rich anything that's going to fix it?
That's also a very good question. Unfortunately, none of these studies has showed effect of stem cell PRP. There are multiple randomized controlled study going on, and there are some centers that they're using PRP for some athlete that you see, but the evidence is not supported enough yet.
Let's get back to the phones. Aileen in Baltimore County, thank you for the call. Go ahead.
Yes, I'm back. I just wanted to know, okay, this hip replacement that I have, sometimes I can go into like stores, like big stores like Walmart, places like that and whatnot, and I get the sensation as soon as I walk into the store, that sensation go into my leg. It's like something crawling on me. It's horrible.
Thank you very much for the phone call. Any idea, doctor, what that would be?
So some of the patients are more sensitive to feeling the implant inside of the body. Usually after 3 months, these implants become part of the body, so you should not feel it. So if you've had this, if Aileen had the surgery for like more than like 5 years, I would recommend to get like an X-ray, make sure everything looks fine. Some of the patients keep the feeling that sometimes the change in the pressure, like they can predict the rain, still like the patients like with osteoarthritis, they have that feeling. They might have it after the surgery also, keep that feeling.
Now, we mentioned you do what's called an anterior hip replacement. What does that mean?
So there are different ways to access the hip joint. You can go from the front, you can go from the side, and you can go from the back. So going from the front has been popularized over the past decade. So when you go from the front, you don't cut any muscles. While going from the side or going from the back, you have to cut a tendon or a muscle. So the advantage of this muscle sparing approach that we call it is that the rehab is much faster. Patients, they have less pain because you don't cut any muscles. Most of my patients, they go home the day after the surgery.
What's normal for a hip replacement?
We've come like a long way. We used to keep the patients at least for a month, for a week in the hospital. We had it that we had to keep them for 2 weeks, do the physical therapy. Now, most of the centers, they keep the patients on average about 3 to 4 days. Okay. So we do like for a day. So that's like the advantage. The other advantage, actually, this hip joint can pop out. So when you don't cut the muscle, so you can see that it can pop out. When you don't cut the muscle, the chance of popping out is less. And also the restriction that you give your patient is less, because with some of the approaches, when you go from the back, actually you have a higher chance of popping out. So you do a lot of limitation of range of motion, so you ask them not to bend more than 90 degrees. With the anterior hip replacement or going from the front, you don't have those limitations.
There must be some disadvantages as well.
So the disadvantage is a little bit more technically demanding to do the surgery, because so you have to get the training for that. It might be a little bit longer procedure for the surgeon, and it takes time to learn the technique. That's the biggest disadvantage of this.
Let's take a phone call from Baltimore County. This is Walter. Walter, thanks for the call. Go ahead.
Yes, sir. I'm retired military and postal, and I retired. Yes, sir. I'm retired military and postal, and I retired and went to work in my yard and wore my hip out. And it was terribly painful, and I could handle all the pain that you wouldn't believe. I mean, for what I've been through in my life.
I bet. What's your question, sir?
But when I had my hip replaced, it seems with exercise it is beautiful, but if I relax it, it'll stiffen up and be kind of sore. But as long as I stay active, it keeps working very well.
Interesting. Walter, how long's it been?
Since July 4th last year. It was July 4th weekend I had it done.
Great. Glad to hear it. Thank you for the phone call. So is that normal? Patients shouldn't expect you're out of the hospital the next day and you're back to perhaps doubles tennis a week later?
Usually I tell the patients that at 6 weeks you have a better understanding of what's going to hip look like, and what your healing takes a little bit longer, up to a year, but at 6 weeks you have a very good understanding what's your function it's going to be and how much better you can get. The first few weeks or few months is the time that you actually can strengthen the muscle and get more from your hip replacement surgery.
Let's take another call. Washington, D.C. This is Judy. Judy, thank you for calling. Go ahead.
Hi, how you doing?
Good. How are you?
I'm glad you're doing this. It was really important. But I wanted to, my question stemmed on weight. Being morbidly obese, some people, what factor does that play in having a hip replacement? Or do you suggest that weight should be lost? Or does it matter? You can lose the weight after you get the hip replacement?
That's a great question, Judy. Thank you so much.
So that's a great point. We measure the obesity bar BMI, which is body mass index. If the body mass index is above 40, we do not recommend to get any hip or knee replacement surgery. The reason for that is a higher chance of getting infection. Some studies showed it's 7 times higher chance of getting infection, but we don't leave the patient alone. So we have a system that helps with the patient. We have a team at University of Maryland that help the patient to decrease the weight. It could be just nutrition, sometimes even surgery. So we have a comprehensive team, and meanwhile, if the pain is really bad, sometimes they're not able to go to physical therapy. For these patients, I do recommend the water therapy or aqua therapy, because you're weightless in the water, so you can burn more calories. And these patients, we can also do the steroid injection in the hip joint, so it decreases the pain for a while. They can be more active and lose weight. And I've had patients, they lost 100, 150 pounds, and we did the surgery for them.
We'll ask Dr. Adib to stay with us for a few minutes. We'll continue on hip replacement surgery. More of your calls. The number will be up on the screen, or tweet to @MPT News. Direct Connection continues right after this.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
Sometimes
the tears,
I get a good feeling, yeah.
Wanting to die. Nobody tells you
I believe
that without it,
I really do believe that
life can be appallingly boring.
Something's got a hold on me here.
You're making a mistake.
Am I? This is really very promising.
Something's got a hold on me right.
I don't think this is such a good idea.
You've been talking to my mother.
I am about to commit murder.
She always had a bit of a dark side. Trying to scare me now. It'll give you a story.
He's in love.
I really wasn't. Stay away from my wife.
You got any idea the pressure I am now under?
Continuing now with Dr. Farshad Adib of the University of Maryland, a hip surgeon dealing with various hip issues. Thank you again for being with us. Bunch of phone calls. Let's get back to it. Montgomery County. This is Iris. Iris, thanks for the call. Go ahead.
I had hip replacement surgery, which was successful a number of years ago, I think 6 or 7 years ago, and I'm anxious that I not repeat it, and I'm anxious as to how can I best take care of my hip.
Great question. Thank you very much. Good luck.
So thank you for the question. Taking care of the hip replacement is really important. So the activity that you do is the main part. So you don't want to do too much high impact sports. I've had a patient who came to me and proudly told me that did half marathon, so I don't recommend that at all. So the second part is to keep your weight low. So obesity puts more wear and tear on the implant. And at the end, I usually follow my patients like annually, the first year, second year, and then every 2 years, and then every 5 years. We get one X-ray to make sure that the implants are in correct position and there are not any problem with the implants.
So the hardware is obviously better than it was a generation ago. Will you ever get to the point where the hardware itself is good for 50 years or more?
Actually, yes. The implants that we have now, so we have the implants that we have now, the study's been done under pressure. So if you use it with the high cycle, they can last about 20 years. So for an active patients, they can last for 20 years. But you do have, if you take a good care of these implants, it can last longer. Obviously, it's a multiple factors. It's not just the implant, it's how much pressure you put it on. And then how much time it goes by, it depends on those two factors too.
Let's take a call from Anne Arundel County. This is John. John, thank you for calling. Go ahead.
I had a femur break from a result from a fall and had needed a new ball on top of the femur. And I find with practically no pain in the operations of actually replacing it, but now I find that it's very difficult to regain the strength in that connection. What is the best exercise to use for that purpose?
John, thank you.
Thank you, John. So for fracture, which is called femoral neck fracture, which is in this area, sometimes we do hemiarthroplasty. We used to do those type of surgery before. So first of all, we got to make sure John gets an X-ray, make sure if this is hemiarthroplasty, so it can puts like some erosion or wear and tear on the inside of the socket. So if we get that, then you have to convert the hemiarthroplasty to a total hip arthroplasty. That's number one. The exercise that you do, usually you work on your core muscle, abdominal muscle, and the key muscle that attaches on the side over here is called hip abductor muscle. The hip abductor muscle is the muscle that actually, so it goes from the pelvis all the way down to the bone over here we call greater trochanter. This is the key and cornerstone of the hip muscle. So we do if you want to look it up, is hip abductor muscle strengthening exercises.
Let's get one more phone call. Washington, D.C. This is Annette. Annette, thank you for the call. Go ahead. Annette, are you there?
Oh, yeah, I'm here. Yeah.
You're on.
Oh, I would like to ask the doctor, what is a hip replacement? I'm supposed to have one in the very near future, and I would just like to know what constitutes a hip replacement. What is it?
We will get you an answer on the air, Annette. Thank you and good luck. And that gets us back to the beginning of this. What is a hip replacement?
The hip replacement is a surgery that you actually go. So if this is your thigh bone, Annette, this is your pelvis, your bone in here, that you have has had damage. So you have wear and tear in the joint. The protective area between the bones is called the protective cartilage, has been worn out, so you have bone rubbing against the bone. So we take the part that has the arthritis and replace it with this implant that we talk about it. So we had different parts. This is stem or pin that goes through your thigh bone over here. This is the ball that it's gonna go over it. You will have the plastic part and a metal socket at the back of that, and that's your hip replacement.
And that makes it look very simple, but it's one of those things where I'm guessing you want a surgeon who does a lot of them in a center that does a lot of them.
Definitely. This is a surgery that can have a lot of complications, so you better get it done by a surgeon who does it on a regular basis, and hopefully that if you have a doctor who has been fellowship trained, that's also an advantage.
Very good. Dr. Farshad Adib is with the University of Maryland School of Medicine, the University of Maryland Medical Center. Thank you and your hip for being with us tonight.
Thank you very much for having me, Jeff.
Appreciate it. Thank you for joining us for Direct Connection. We're back Thursday at this time with Your Money and Business. We'll learn all about Baltimore's new water taxi. For all of us at MPT, thanks for watching and have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.